So if you have to give one advice to somebody who is thinking to start their own digital health business, what advice that would be?
Well, it's a great time to start. Great time to start this type of business. In the digital space, we've got so many tools available to us. Particularly talking about AI. These AI tools can basically accelerate your sort of discovery and testing in ways that you wouldn't be able to do before, and such, essentially cost-free. You have to put the time and effort into it. So doing some research, doing some early iterations, doing some coding, doing some testing, and get that off the ground. Get some concepts up, and don't be afraid to approach people with your concept, with your idea, and ask questions. Some founders or early startups, they might be a little bit shy in sharing their product or their software because they think it's a bit too raw, or maybe they'll be sort of judged in a certain way. But the only way for you to really find out is to kind of get out there and test it and get comments from people who have valuable feedback for you. And without that feedback, you're sort of working in the dark. And the only way, it doesn't matter where you are, the way you're going to get this valuable feedback is to put it out.
Welcome to the Convergence Play podcast.
Thank you. Thank you so much for taking out time and joining the call. I really appreciate. I know this must be very busy part of the day for you, but we truly appreciate you taking out time and being here and open to sharing your story for our audience. So with that, I think we can get started. I was going through your profile, and no doubt you have a very impressive experience in healthcare domain. So I think it can be a great starting point. We can start with your introduction, your journey, and your vision behind Lexi Health.
Yes. So just introduce myself. I'm John Nguyen. I'm an optometrist based in Australia, 20 years experience in eye care. For most of my career, I've been concentrating on building our chain of optometry businesses. To date, as of January 2026, we're at 10 locations across Sydney, and we're continuing that expansion. And so it's on the basis of that professional experience that my latest venture, the Luxi Health, was born. So being a practicing clinician, I'm still seeing patients day to day. An area that I focused on was the area of myopia control. So a lot of pediatric care, seeing kids, they're coming in, having difficulty seeing, and then we diagnose them with myopia. And that's the lifelong journey of, educating them, managing their eye care, managing expectation around vision and glasses and contact lenses. And that area, that field, it's been expanding and growing very quickly because the knowledge base is starting to catch up, and new technologies are coming on board. That makes it better to manage these conditions. But I did find that there was still a big gap in where our advice and the implementation and the implementation of advice to the patient, there's a big gap there. So I started this journey on, how can we make that better? How can we improve that? And, being someone who's interested in technology, started to look at digital forms of trying to increase compliance for the patient. So the big area that I was looking at was outdoor exposure. It's a big advice from us as eye care health professionals. We would always advise the patient 2 hours a day is protective and beneficial for their eyes. Okay. So even yourself, you may not be in the eye care profession, that probably makes sense to you immediately. Get away from your screen, get away from your devices, get outdoors, and that's going to help protect your eyes from further deterioration. So we all understand that, but putting that into practice is very difficult, right? So in this day and age where everyone's got a phone, everyone's linked to that, we're so reliant on it. Instead of seeing that as a big problem, we can't avoid it. That's our day to day now. That's our modern day living, 2026. It's the reality. So how can we use that tool to help encourage this change in behavior? So it's caused an adverse change in behavior kind of too far, but now we can leverage these digital tools to kind of correct it and bring it the other way. And patients are open to that advice. They just need a tool or some mechanism to help coach them and help them adhere to that advice. And clinicians as well, like when you're an optometrist, an eye doctor, if you give that advice, you just say to a patient, look, I want you to spend 2 hours a day outdoors. You've got no way of monitoring it. You've got no way of tracking it. So you give that advice. You see the patient 3 months later. Everyone said it was too hard. And then we sort of say, okay, it's too hard. And we'll just drop that advice and we'll stick to the other therapies that we're more comfortable in managing and managing compliance. So that was born from there, and sort of an interesting journey. Digital devices, technology, it's all available to us. But also, during the development of the products for Luxi Health, it also kind of gave me some insights in how other areas of our practice, of our business, are lagging behind in sort of digital implementation.
Right.
And that's classic for probably all healthcare professionals, because healthcare professionals are very much creatures of habit. What's working for us now, we sort of get comfortable in there, and it's very hard to break out of that.
Right.
So that's another area of exploration. And it just made it clearer to me, right? As I was sort of working on my app and my hardware and the tools, we can iterate so quickly, and the movement, the traction gets so quick. And then sort of the traditional eye care delivery, healthcare delivery, leaves much to desire, and I think that's a big opportunity for myself anyhow. But I think if I speak more broadly for healthcare practitioners around the world, I'm sure they would feel the same.
Thank you. Thank you for sharing your story. And one key thing that stands out is your authenticity, because you have been working in this space yourself as a clinician, and you saw that pain point, and now you are trying to address that pain point using technology. So it really speaks up a lot about your authenticity, and I think that's where the real impact will come. So for the sake of our listeners, I think it would be great, John, if you can share a little bit more about Lexi Health product. As far as I understand, it's wearable as well, and it's mobile applications as well. So it's your own hardware, or it is something that can be integrated with existing wearables as well, for example, Apple devices and others.
Yeah. So our first hardware device will be our own proprietary design,
Okay.
because at the moment, the outdoor tracking, it actually requires some dedicated sensors, and the way that sort of typical consumer products are on the market, they're not very well built to incorporate that into their designs at this stage. So it did require us to design our own product. And so just to describe that product at the moment, it is a wearable. And at the moment, our first iteration, it is targeted towards children and kids, because that's the highest risk population at the moment. So kids coming in, sort of between primary school age, that's when we first start seeing the signs of myopia, short-sightedness. That's where all the attention is. That's where all the research is. So everything that we do is all scientifically validated, and that's where all the research is built upon. So that age demographic and understanding of this condition, this disease. So it's a proprietary built wearable. Now we're still kind of early on in the design phase. I mean, prototype we've completed, but how it attaches, whether we wear on the wrist or wearable attached on the shirt, we've got flexibility there. And probably being a parent myself, I understand that as a device, you probably want multiple modes of wearing, because kids, they're all different. Some don't like it on their clothes. They like it on the wrist, but then in some application on the wrist, you might need to change it to a shirt, like maybe they're doing sports or swimming or whatever else. So having that flexibility in the modality of wear is important. That's sort of the basis of it, a wearable device, and that's paired with an app. So the app itself, we're tracking it, we're measuring it, monitoring it, and then Of course, first version, we're just keeping it very simple. We want to sort of prove that we can track and monitor and get that engagement from the parent, from the child. And the other good thing too is in that first version, we are building a mechanism to report that back to the clinician. So their optometrist, the right doctor, so they can report back the statistics. And then I think that's one of the key aspects of our, where we should have success, because we're getting sort of, it's built upon that sort of the triad of the patient, the child, the parent, and the clinician. And if all of them are seeing value in it, then it's going to be more effective. Okay. So being a parent, if I had a device and I said to my daughter, my son, I want you to wear this and force them to wear it, they'll just don't want to. They'll resist. They'll take it off.
Yeah.
They won't use it, right? So we built it around the child experience. They have fun with it, like this sort of gamification and rewards if they keep the streaks, and then we'll make it simple for the parent, easy to monitor, easy to track, and then for the clinician as well. Again, just a simple way of recording and monitoring and giving tailored advice around the results that they're achieving. So that's where we're starting. But it's an exciting area because, I mean, when you start a business, of course, you always start with the grand vision, right? What can we achieve?
Yeah.
But then, sort of the realities of business, you kind of got to take those steps one step at a time and sort of reiterate, learn from the customer experience, the user experience, get that feedback, and then you sort of build that and then move forward. So
Yep.
that's what.
It's all about being agile. I mean, being flexible, being agile, listening to user feedback, and then improvising.
Yeah.
And I'm sure as you progress along, the integrations with other wearables will be, of course, something which you will be definitely exploring. And as you know, technology is advancing, and these challenges are relatively easy to deal with. All you need is probably APIs to integrate with other systems and other devices. So when you were talking, and something came to my mind that, as far as I understand, there are three key stakeholders in Lexi Health. One is children's, one is their probably parents or guardians, and one is clinician. So how are you currently managing the flow of communication between these three? Is it also being done using the same app or additional software or application, for example, EMRs or patient engagement tools for that?
Yeah, good question. So again, just being early on in our business, we're just keeping it very simple. It's all right now. We do get the data through the app, and that we can report that back and use analytics to measure that. Now, sort of further on down the track, we do want to build clinician portals so they can access the data and integrate it within their management systems as well. But at this early stage, it definitely is just through the app. Keep it very simple. Keep it light. We still got a few points to validate before we sort of invest all those sort of external systems around that. Yeah, but at this point in time, look, we're still early on in our business journey where we're just at the prototype minimum MVP stage, pre-revenue.
Mhm.
So we've still got all those points to validate first, but that is the vision. We do want the clinician portals and integration into the management systems. Again, until we can sort of get that revenue, prove those points of validation, because that adds complexity, regulatory navigation. We're just not at that stage to navigate all that at the moment. So we've still got a bit to achieve, but yeah, that's all part of the pipe.
It's good. It's good that it's in your roadmap. And if we linger on a little bit on that, is it safe to say that if things progress well for you, maybe having a clinician portal or a engagement portal and integration with other wearables, maybe down the road at the end of this year or the start of next year, something like that, if you keep growing at a good rate, is this something safe to assume?
Yeah, I would say so. First, we just got to prove our traction with the user, get that initial feedback. And then because the clinicians are the key to our success, really. I mean, the clinicians aren't the one purchasing the device, but they're going to be the ones that are going to be recommending and recommending our advice to their patient. So it's going to be the accelerator to the user onboarding. Their feedback is important, and even at this early stage, as I sort of get around and talk to clinicians, a lot of them are already hinting, when can you get the clinician dashboard to us so we can have full visibility, see it live, because that's the way the clinician minds works, right? They want to see the data,
Yeah,
and they want to have that coming through, and before the patient comes in, if that data is already there laid out for them on the dashboard, they already know what they're dealing with. They can prep themselves for tailoring the advice as it comes through. So that's the goal, and we I think with anything, like, you want to reduce those friction points. If it's all automated, ready to go, it makes it easier for everyone, and that's sort of what we're going to be going for and targeting. So that is part of it. It definitely is part of the vision, and so it is important for us to make sure that the clinicians are engaged and see the value in it.
absolutely right. When earlier you were saying that it is not always easy for business owners, digital business owners, to get clinicians to change their mind. I mean, you have to go and show them. And I think if you are able to show them that the solution you are bringing in is going to reduce their administrative burden, or is going to reduce their cost, or it is going to reduce their operational burden, I think this can become a very good convincing point. So yeah, I think it really makes sense that once you grow and then you invest a little bit into these portals in place, it is definitely going to improve overall adoption of Lexi Health. So I think you answered one of my question I had in mind, was that who is your customer? Are you in B2B space or B2C space? But my understanding is that you're probably right now in B2C space, but please correct me if that's not right.
Yeah, the way we see it is we're B2B2C. So my engagement right now is to work within my networks of the eye care professionals, so optometrists and doctors, within Australia and around the world as well, because they're the ones that understand the science first and foremost. Okay, so the first adopters are the ones that really understand myopia and the management of it. Around the world, even say within my city, my country, optometrists, their understanding of myopia, um, you know, it's quite varied, and so not everyone's going to be able to take it on immediately. So the ones that we target first are the ones that are very knowledgeable around myopia and the management of it, and they'll see the immediate value to this tool, this device, straight away, because it's a gap in their treatment plan, in their advice protocol. So if we can offer basically a seamless solution where give it to the patient, it'll allow you to track that outdoor time, something you haven't been able to do with anything else, and um, you know, and that information displayed to them easily doesn't get in the way of their clinical protocol, then they're the ones that are going to be able to endorse it, right? So most of the marketing and efforts will be within the clinician space, and from a business perspective, that sort of makes sense as well, because traditionally, um, sort of acquiring sort of customers through those avenues of the clinicians, much more cost effective than us sort of mass marketing to the public, more broad mass marketing campaigns. Those campaigns are more costly. So this is a more efficient use of our capital. But the advantage is, I'm a clinician myself. I'm an optometrist. I can speak their language. They know. I can speak directly to the science. So that makes sense to them. I'm not an outsider coming in with a product that I think will work. I already know that there's a need there, and even my early discussions with colleagues in Australia and around the world, they're very excited to see the product and take it on when it becomes available. That's the first stage. We think we can get the quickest traction there, the most cost-effective traction there. And now, in time, making the marketing directly to the consumer, that would be part of the strategy as well, because the general public can benefit from this change in behavior as well. Okay, so that's probably like more the midterm goal. I think we can get very very quick traction through our clinician network. So to answer your question, we're targeting a B2B to C.
Thank you. Thank you so much for clarifying that. So as you grow, I assume that you will be handling more the recent data. So for the sake of our listeners, what kind of security you have in place in terms of making sure that patients' data is safe, protected? What mechanisms you are following right now in this regard, and what do you have in plan in order to keep improving in security realm?
Yeah. So now, of course, I'm not a tech guy. I'm a clinician, so that's where my expertise lies. But in saying that, of course, any data that is held, it's all de-identified. Okay, so we can't identify a patient. Patient clinical records are held. So at the moment, the only data that we do keep is basically things that it's so outdoor exposure time, minutes spent outdoors. There's no geolocation, so there's no privacy, of course, very important. So, patient privacy, that's probably the biggest thing that we're mindful of. And that's sort of this is a requirement from Apple and Google on their apps anyhow. But sort of moving forward, as we move into more patient collection data and clinician portals, that's where the complexity builds, and yes, security will be more important there. So we're not at that stage yet, but we are very mindful of that, and that'll be part of our strategy as we do grow the business.
So, as you are currently operating in Australia, are there any mandatory security regulations that digital healthcare service providers like yourself have to follow, or it is or it's mostly up to your own choice of which kind of security mechanism you need to place in? Because, for example, in US, HIPAA is very important. It's something that all digital service healthcare service providers have to adopt and follow. Are there any standards like that in Australia currently, or there are?
Yeah, Australia's a little bit different. We're working on sort of a different framework. I mean, it's up to the provider to ensure that the systems are robust, but yeah, there's no sort of direct protocol like the US. So once we expand that, we do have to make sure we're compliant on HIPAA. I
That's
do understand that.
yeah.
But in Australia, a little bit different, the framework.
Understood. Understood. So again, what you are trying to do does not come free of challenges. There must be many challenges on daily basis that you might be overcoming. So, in your opinion, what's the typical day-to-day challenge or frustration that you run into that really impacts what you are trying to do?
Yeah. So, just kind of managing our small team, even though it's a small team, like maintaining communications and keeping our records, up to date, and making sure that version control um, is all sort of followed. Yeah, I mean that's all part of it. I mean, look, we're still early on, only it's a very small team, but even that, well, following those procedures is important. Just setting up those systems and protocols so that we're set up for the growth of the business. That's important. Um, yeah, that's probably the main thing, really. Right now, I can't say we have too many technological challenges outside of that.
That understood. So how big is your team right now, and is this in-house team or do you have teams spread across multiple countries?
No, just in Australia. So our team right now, there's only two of us really. And there's a couple of external consultants. So very manageable at this stage, but with an eye to the future, we're going to lay the foundation for growth on the back of that. Yeah.
I can assume based on our conversation, I think one of the key area once you are at an expansion state, maybe workforce or right technical or engineering folks to help with all those great growth areas which we talked about. So thank you, John, for sharing your insight so far. And one important question: where you want to see Lexi Health in next 3 years? What is the big picture vision for you?
Yeah, so by year three, look, we hope to have expanded, multi geographies. So have a good footprint within Australia, of course, Southeast Asia, and the US. So there are big markets. I say that for many different reasons. Australia, and I'm based here locally, but a lot of the myopia expertise, a lot of the research is done in Australia. Southeast Asia, of course, huge problem with myopia there. There are 80-90% myopic rates. So solving the problem there and make a huge impact on making a difference. And then US, the big market, and very established optometry network, rising rates there as well. So that's where we see us, in 3 years' time, it can, break into those three markets, establish ourselves there, and just got the opportunity here to be basically um, we set the tone for this message. Outdoor light measuring, no one else is doing it, and if we can set the tone and set the precedent and be the voice, the go-to brand, become recognizable by clinicians and by the wider general public, then we're a couple of steps into achieving our mission.
That's great. That's it. Thank you. John, a lot of our listeners are actually either founders or C-level executives or those individuals who has big vision and they want to start building projects in digital health space. So for somebody who is just thinking about building their own product, what advice would you give them? I mean, I know this is like a very complex, tough, and full of challenging field. So what we want to do is share your insights, your learning, and your recipe of success in a way that it may help others as well. So if you have to give one advice to somebody who is thinking to start their own digital health business, what advice that would be?
Well, it's a great time to start, a great time to start this type of business. In the digital space, we've got so many tools available to us, particularly talking about AI. These AI tools can basically accelerate your sort of discovery and testing in ways that you wouldn't be able to do before, and such, essentially cost free. I mean, you got to put the time and effort into it, but doing some research, doing some early iterations, doing some coding, doing some testing, you can get that off the ground, get some concepts up, and don't be afraid to approach people with your concept, with your idea, and ask questions. Some founders or early startups, they might be a little bit shy in sharing their product or their software because I think it's a bit too raw, or maybe they'll be sort of judged in a certain way. But the only way for you to really find out is to kind of get out there and test it and get comments from people who have valuable feedback for you.
Thank you. Thank you so much for this powerful advice. And I thoroughly enjoyed our conversation. I think we talked about many areas. We talked about technical aspects. We talked about challenges. We talked about your big vision, big picture. And I think one thing that really, as I started in the start, as I said in the start, one thing that really stands out is your authenticity for this purpose, which the problem you are to solve or the challenge you are trying to overcome, and your past experience really connects with that. And I believe you have a very clear picture on the vision and what you will need to get there. Of course, you may be in early stages right now, but yeah, I think you realize that you need the right portals in place, right tools in place, right team structure maybe in future once you are growing, and of course the considerations you have around taking care of security measures once you grow to other regions and other geographies. I think they all are the right things to keep in mind. So I wish you all the best, and we look forward to getting your story out in the public. And of course, let's be hopeful for a great future for Lexi Health. Thank you, and have a good rest of the day. Bye bye.